Hello everyone, it's Dr. Jeff Boone. I look forward to seeing you at Symposium this year in Scottsdale. Wanted to give you a little preview of our lecture and discussions about stopping heart disease before it stops you. Today we wanted to just focus a bit on blood pressure. Now blood pressure is an important entity that affects the heart, the blood vessels, the brain. Probably everything from Alzheimer's to kidney disease has a blood pressure component. And one of the unique things about our work at the Boone Heart Institute is we go beyond resting blood pressure to look at your mental stress pressures. So just now in front of you have a monitor that has shown my resting blood pressure. And I took that sort of in the middle of a workday just a few seconds ago, and the blood pressure is 123/79, which is not bad. My heart rate is 67. Now, what we found in the medical research world is that the mental stress blood pressure, the blood pressure that you have during the workday, is actually much more predictive with regard to your heart disease and vascular disease risk. So in a moment, I'm going to use one of the stimuli that we use to simulate mental stress by putting my fist in a bucket of ice water. And we found that that brings out the kind of blood pressures that I might have during a very stressful part of my day. And then that is a building block upon which we build all of our associate efforts about how to stop heart disease with regard to both medications, micronutrients, as well as lifestyle changes. So let me now put my fist in a bucket of ice water and remeasure my blood pressure and give you an idea of what we can measure when we see you at Symposium this year to decide your mental stress response. It really doesn't have anything to do with how you handle stress, but what is the physiologic response when the high adrenaline approaches are in your life. So here I'm putting my fist in a bucket of ice water. It's kind of an unpleasant stimuli, but we found even as early as studies from the Mayo Clinic and from the 7-country study in Minnesota that the abnormal, the excessive response to ice water challenge can be a very good predictor of cardiovascular disease and cardiovascular risk. And as you can see, the monitor has now gone to above 140 because probably my blood pressure has surged a bit. And maybe my blood pressure will be a little bit higher because I'm not only talking with you, but also have my fist uncomfortably in a bucket of ice water. But that has a very good predictive ability. Look at that, 162/101. You want that information about yourself. You want to know about your cardiovascular risk. And then associated with this surge of blood pressure is then shear stress on plaque, excess clotting of blood, arrhythmias, even changes in your cholesterol and metabolic profile can occur. So stop by the Boone Heart Institute booth for not only your carotid IMT, but also your blood pressure assessment during mental stress, during symposia in Scottsdale 2014. And we'll see you there.